Now, let's go to the main part of the interview. Look back to the beginning of the chapter and remember what you thought would you help to begin to share your news with the other person. Now, think what that person would do to help you to continue to share your entire story. I think you probably would expect your friends to ask appropriate questions, listen attentively and demonstrate interest, help you to continue if you get stuck. So, questioning, listening, and facilitating are three of the key skills that enable us to communicate effectively with others, and they each play the role of the verse, refrain, and the interlude. Let's discuss one by one. One of the purposes of interviewing a patient is to obtain information about the condition of which the patient is seeking help. The information must be accurate, complete, and as relevant as possible. The most obvious and direct way to obtain information is to ask questions. However, studies of medical students and doctors have found that they often ask too many questions and do not allow the patient to tell their story in their own words. Ask questions that are too long, too complicated, and confusing. Ask questions in such a way that they may bias the answer given. Ignore questions that patients may ask. So, it must be concluded that asking questions is a valuable skill that needs to be learned. Asking open questions enables you to obtain a great deal of information and also allows patients to tell their own story. Open questions should be used as much as possible, particularly at the start of the interview, such as, "Would you please tell me how you have been feeling in the past few days?" Asking specific questions or closer questions give patients little choice in the way they answer, and usually elicits a yes or no answer, such as, "Have you been feeling unwell today?"
I see from your notes that you have some chest pain. Do you still have it?
No, not now.
Was it tight or dull?
It seemed to be a very dull pain.
Did it go down your arm?
No, it didn't.
Did it get worse when you're doing exercise?
No, I don't think so.
I understand that you have pain. Could you please tell me more about it?
Well, it was in my chest, and it came on when I was sitting at my desk. It was a very dull pain that stayed in the middle of my chest. I had it for a few times recently, always when I'm at work.
Can you tell me what gripped you?
Well, thinking about that, I've been very busy at work recently, and the C2 came on when I'm rushing to finish accounts. It was also happening when I'm worried about funding.
This case illustrates the advantages of using open questions and the disadvantages of closed questions. Dr. Weil obtained considerably more information by using open questions than Dr. Yates, who used closed questions. However, is open questions absolutely better than the closed one? The answer is no. Closed questions are useful when it is necessary to obtain specific questions that the patient has not given, or when a patient is shy or withdrawn and does not readily provide information. Closed questions may also be appropriate when it is necessary to obtain a limited amount of factual information in a limited period of time. For example, when a patient in casualty present with a painful arm after fall, you will need to know quickly the site of the pain and if movement is possible. And using open questions does have some advantages. as follows. It is usually necessary during the interview to use probing questions that help the patient to think more clearly about the answer he or she has given. Probing questions may be used to clarify, justify, check accuracy. The questions asked during an interview should be easily understood and asked in a way that does not influence the patient's response. Complex questions and leading questions should be avoided. Complex questions that encompass several questions in one are likely to confuse both the patient and the doctors. For example, how would you respond to the question, "Did your vomiting start yesterday or hot today, and have you had a diarrhea?" The chances are that only one part of the question will be answered. Leading questions encourage the patient responding to give the answer that the interviewer expects or wants. In the context of interviewing patients, leading questions may be useful and opening ploy, but on the whole, they are to be avoided for reasons that will become obvious. There are three types of leading questions. It can be used to open or stimulate conversation. They can encourage rapport, such as, "Aren't we have awful weather this year?" Please influence the patient to agree with the interviewer's viewpoint and should not be used, such as, "You don't sleep well, do you?" Please use the wording of the question to influence the respondent. They should be avoided, but it is easy to use them without realizing it. A good example of how the wording of a question can influence the answer was shown in a study of the frequency of headaches in a group of individuals. When respondents were asked, "Do you get headache frequently, and if so, how often?" the average response was 2.2 headaches per week. When the question was slightly changed to, "Do you get headaches occasionally, and if so, how often?" the average response was 0.7 headaches per week. Image that you are in another country and you need to ask for directions. You ask someone who is willing to help, but you speak little of the language. Please think about what makes it easier or more difficult for you to remember the directions you are given. Firstly, let's see common barriers to effective listening. They are too much information being delivered at once, being preoccupied with summing up with what you are expecting, worrying about offending the other person. In the setting of the medical interview, patients appreciate and respond positively to the doctor who listens carefully. Listening is one of the most obvious components of the communicate process, yet active or effective listening is one of the most difficult skills to acquire. Listening involves not only receiving information, but also, and more importantly, being in tune with the speaker and responding appropriately. This is active or effective listening. It is not easy and demands effort and concentration. When interviewing a patient, it is important to demonstrate that you are paying attention and trying to understand what the patient is saying and feeling. The key features of ACT lesson are: focus on gathering information, which is a complete, accurate, and a representative account of what the patient has come to tell you. Understanding the implications for the patient of what is being said. Responding to verbal and non-verbal cues, demonstrating that you are paying attention and trying to understand. Patients may be unable or unwilling to articulate their real concerns and feelings. However, they are likely to reveal something of this during the course of the interview, and it is important that their verbal and non-verbal cues are picked up. Listen carefully to the way patients describe their problems for signs of their underlying concerns. They may reveal this only if you respond appropriately to their verbal cues.
Hi, Mr. Fine. How can I help you?
Well, doctor, I thought I had to come to see you. It's my headaches.
Can you please tell me more about your headache?
Well, they are really bad, and they are driving me crazy. And they came to me soon after my mother died. And now they are making me dizzy. I'm really worried about it.
Can you tell me why you are worried about it?
Non-verbal cues. We reveal a lot of information about ourselves and our feelings in our body language, like the way we dress, our posture, gesture, and facial expressions. When you interview a patient, you can learn a good deal by watching the patient enter the room from his appearance, posture, and gait. It is also important to be sensitive to a doctor's body language during the interview. Here are some examples of nonverbal cues. Difficulty in maintaining eye contact may indicate that the patient feels depressed, embarrassed about what is being discussed, and uninterested in the conversation. Conversely, excessive eye contact may indicate anger and aggression. The confident person will sit upright. The patient who feels depressed may sit slouched with head bent forward. For example, an angry patient may sit with clenched fists, whereas an anxious patient may wring the hands or tap the feet continuously. We can identify the sadness, anger, and happiness. We can get something from patient's tone, speech rate, emphasis on certain words, and the vocalization other than with words. This is sometimes called paralinguistics. It is essential to show the patient that you are listening carefully. This can be done by appropriate use of eye contact. Posture, for example, sitting slightly forward facing the patient, nodding your head and say, go on. You can also demonstrate active listening by asking questions directly related to or following on from the patient's last statement. To do this perfectly requires a lot of clinical practice. When you are required to take a course assignment or exam as a medical student, the task may involve the listen to a message containing a lot of information. You probably find that information was lost as the message was passed on because there was so much to remember. Some judgment is required to ensure that the most important information is retained. The message was probably transmitted inaccurately as each person unwittingly changed it to what they heard and understood. When listening, we tend to rationalize information to fit in with our own experience. What would help us to listen in such a way that information is registered and passed on accurately? Possible ways include taking notes, asking the speaker to repeat or clarify parts that are not clear, checking that the information received is accurate by repeating or summarizing it.